Hi, I'm Joy.
Hi, I'm Susan.
And this is Girlish Gurus. And Susan, why are we here?
We are here to start a conversation about female empowerment and the issues facing women our age at this time, and to have some fun along the way.
So, let's get started.
Okay.
Welcome back.
Welcome back. This is Susan.
This is Joy. Today we're talking about another big topic. We're fortunate that we know so many women who have so many great experiences and so much valuable information that we can share. And one of those women is actually my own sister, Mickey. And I'm going to give her a chance in a second to introduce herself and to talk a little bit about her background. But I can tell you, when it comes to the world of insurance, which is a financial issue, and particularly for women of our age, if you are unmarried or you're widowed or you, for whatever reason, are living on your own, this is going to be a topic that you're going to want to pay close attention to. So I want to take just a second to introduce my sister and let her give a little bit of background and explain how she has significant experience in this issue and topic. Hello, welcome.
Hello, thanks for having me.
So this is my sister, Mickey Alford-Lane. Mickey, tell us a little bit about your background and how you have relevant experience on this topic.
Okay, so first I want to give a shout out to my hardworking, loving, supportive husband and father, especially right now. I've recently had some major surgery, and so he's my primary support, but also so are my two young men, the oldest being 22 and the youngest one being 18. I've been a stay-at-home parent to them for 22 plus years now. My background in this, prior to leaving the workforce to stay at home to raise our children, I was 6 years into a career in human resources, which primarily was HRIS and compensation for employees and board of directors. And I wore some other hats too. But prior to moving into that position, I supported, for a short time, the benefits department. I didn't realize how helpful it would be in my future with children, because I live in the world of autism. I have permission to talk about that, but that's not my story to tell. But it's relative to what we're going to be talking about, because I've worked inside the healthcare insurance industry in terms of utilizing healthcare insurance benefits, and I've done that for a very, very, very long time now. So I have a lot of experience with respect to healthcare insurance, more than I really care to have, but it's been very helpful. And you mentioned that it's a financial issue, and it is very much a financial issue. And as a result, we've managed to utilize our benefits better than what I think an average person is able to do.
So our target audience, obviously, is women who are 45 and older, women who are in that age group where they are beginning to experience menopause and other health-related issues based on their age. And so my question about that is how insurance plugs into that and how that works. And I know most people don't really have the background to manage insurance. And Susan, jump in anytime you want here, because you have that insurance background from a corporate perspective. Right. But most people don't really have that background to manage their insurance. And some women may not have it at all. And so my question is, how does that work for women who are 45 and older, and what can you do to get the services and the help you need as much as possible in a healthcare industry that really discounts healthcare issues for women in that age group? Does that make sense?
Yeah. Yeah. There's just so much to unpack.
There always is.
We can do.
Yeah.
We can always do another episode, Mickey.
Well, this is a topic that's gonna unravel over a period of time, I'm sure. And this is a very relevant topic, because no matter what, money is like food.
Right.
You have to have it to live. And in this age group, for women who are maybe unmarried or for whatever reason find themselves living on their own, especially after the pandemic, and in this economic time we're living in, this is a big, big issue.
It is. And given the topic of today's conversation, I took the liberty of gathering some current data or stats, and I think it will help in demonstrating what I feel is a broken healthcare system. A broken healthcare insurance system.
We've already talked about it.
I'm shaking my head. I'm shaking my head. Yes.
I'm not going to get too far up on my soapbox, but I do.
Oh no, we're all about the soapbox here.
Okay, I do just want to briefly say that our system is broken. It's hard on everyone. It doesn't serve everyone when they need to utilize their benefits very well at all. And it's particularly difficult, as some of my stats will demonstrate, it's particularly difficult for women.
We're going to include all of the links, the relevant links from this information in the description of the podcast episode. So anybody who's listening and wants to look at what we are looking at, you're going to have access to that in the description of this episode.
Right. So first, according to Statista.com, there are 31.53 million women ages 45 to 59 as of 2020 in the United States.
Wow.
And so that's the block of women. That's our target audience today. But I also want to mention that there are 98 million women ages 19 to 64. So
wow, can you believe that? Well, both of us are looking at each other like, wow.
Probably, what is that? About 10% of that group are women ages 45 to 59. And the reason I did ages 45 to 59 is because those are the ages where we are most likely to experience perimenopause, menopause, a variety, unfortunately, breast cancer, the need for hormone replacement therapy. My opinion and what I'm reading is women are more prone in those age groups to develop food sensitivities or allergies.
Really? Interesting.
Allergies, right. Yep. There's a thought that there's a connection between their hormones, imbalances. There's a lot of things that start to happen to women, particularly ages 45 to 59.
That is so interesting to me. I didn't realize that, Mickey, because that happened to me.
Oh, what?
The food allergy popped up a couple of years ago for me. I had never had any food allergies ever. I have tons of others, but never food. And a couple of years ago, I ended up having a food allergy to shrimp.
Yep.
Ate it my whole life, a ton of it. Never had a problem. And then boom, all of a sudden, had a reaction, and I went to get tested, and here I'm allergic to it.
Interesting.
Right. So these are things that I know aren't considered, and this is when we need our insurance.
Right.
Right.
Yes. Right.
Not that we didn't need it before.
No, but healthcare generally is expensive, and there's a whole body of issues around how to pay for the treatment that you need, how to find the treatment that you need, and it's in network and etc. So
and there's the trick. So going back to the Kaiser Family Foundation document that I'm utilizing here. So of the 98 million women ages 19 to 64, 38% have employer sponsored healthcare insurance plans in their own name, meaning they are the employee. 23% of those women, they have healthcare insurance through their employer, but they are listed as a dependent. They're not the employee, they're the dependent. They're it's on their spouse or significant other. 7% do direct purchase. 16% are on Medicaid.
Right.
5% others are 5%, and I'm assuming that means like COBRA or small, not well-known plans or something. It wouldn't include Medicare because it's only up to age 64. So 11% of women in the United States ages 19 to 64 as of 2020 were uninsured.
Wow.
So, Mickey, is one of those categories, or would one of them include anybody utilizing the ACA, Affordable Care Act?
So probably what I think is the direct purchase is the ACA.
Okay. And what percentage was that again?
That is 7%.
Wow, so that's not a lot.
Right.
Okay, so we've kind of walked through
The statistics
of all of this. So
yeah,
I've been fortunate enough to have jobs where my employer paid for my health care insurance, and in most cases it was very generous, and I was very fortunate to be able to have that. So
right.
And I think that's the case for most of the women I know. However, there are many women out there who are not that fortunate, that may work part-time, or their employers just don't provide that, and they make sure that they only work enough hours to not have to
provide
pay
it.
that.
Yes.
So let's maybe kind of go down that path of what are the options available for these women, and how do they maneuver that?
Right. So we're all probably pretty much familiar with whatever options there are. There's no I've never discovered any like secret
No, of course not.
of
Yes.
coverage.
I think as a bankruptcy attorney, I would know. Right. And there's none out there. Right.
Yeah. Right. So, so real quick, so going back to uninsured women and ways. So I listed ways that, there are only a few ways to manage to access healthcare insurance benefits. So you have your employer sponsored insurance plans. You have non-group or direct purchase, which is what my friend does, and I'll kind of explain what what I'm talking about there in a second. You have Medicaid, which has a particular criteria. You have COBRA, which is a particular type of coverage, and it is not long-term. It is 18 months. I think it's still 18 months. And then you have military TRICARE, Joy, which you will be familiar with. And you have the ACA, and then you have community health centers. So those are all the ones that I can think of for the age group that we're talking about. So with Medicaid, there's a certain criteria that you must meet, right?
Right.
And it cuts out women who are maybe self-employed.
Right.
And they're growing, but their income will be too high in order to be able to be on Medicaid. Plus, not all states are friendly to the Medicaid expansion. COBRA is a short-term coverage, and COBRA happens if you've been employed and you lose your job, you can opt for COBRA. Or if you have been in a relationship or a marriage where your spouse or significant other covered your benefits through their employer and you end up separating and getting a divorce, then you can utilize COBRA. So it is a short term, it's 18 months. And what happens is that you basically pay the entire premium, but they let you stay in the plan.
And it can be expensive. I've done it.
Yes.
So it can be expensive.
For a short time, I had to use COBRA. And at that time, it was probably more like $500 a month. I know somebody who utilized it within the last couple of years. I want to say it was $780 a month. Because they ended up separating and divorcing their spouse. So then you have your military, which obviously you can't access unless you're in the military. Then you have the ACA. And the ACA, you can go out and buy insurance. And this is where my friend comes in. She's single. She'll be 50 this year. And she's a mother of two young adults who are on their father's healthcare insurance. So she utilized COBRA. Now she did direct buy, and I called her and I said, hey, I'm going to be doing this podcast with my sister and Susan. I said, we're talking about women our age and healthcare insurance. And she started laughing. And so what she did is she sat down and she said she spent about 80 hours evaluating whether to take a plan off of the ACA or to do a direct pay or a non-group insurance purchase. And she said they don't make it easy, and she is correct, and that insurance providers have left. And so in some states, there's very few providers. In fact, I'm not going to say 100%, but in North Carolina, I think that a year or two ago, the only healthcare insurance provider for the ACA programs was Anthem Blue Cross.
Well, Mickey, that's actually what I'm utilizing right now because I resigned from my job. I paid for the COBRA for the first 18 months. And then I did what your friend did. I had to do the research on purchasing of private or using the ACA's programs that were available. And I think currently, if I'm not mistaken, there may be two companies, but the company outside of Blue Cross Blue Shield is difficult to find. It was for me anyway with my current providers.
Right. What made you decide to go with Anthem Blue Cross? Because for my friend, what it came down to was the ACA, the products that they only had one of my 6 doctors on the plan. And then the private pay is the one I went with because they have 4 out of my 6 doctors.
Yeah.
So Anthem had more providers for you than
they did.
Than the other.
I was lucky. Anthem had my primary care, and then I utilize a dermatologist, and they were both in the program, and as is my gynecologist. So I was fortunate because I don't think that usually happens.
Right.
No, it doesn't. And so my experience with healthcare insurance is primarily within the mental health care world because of autism, ADHD, ADD, anxiety, and executive dysfunction, with ADD and ADHD falls under executive dysfunction. My experience with those things and getting mental health care providers as intervention services, and I've done this for decades, trying to get, even on employer-sponsored plans, it's much easier, but trying to get an in-network provider, there's caveats. If your child is not getting along with the provider, it doesn't matter if they're in network, you have to find someone else because the provider can't help them and they are not being cooperative, so there's no benefit. So finding an in-network mental health care provider, such as a psychologist or a psychiatrist, for pediatrics is very, very difficult, especially in the high cost of living areas. And also during COVID, the wait list for even in-network providers is very long because COVID, right? Because
we just talked about
struggling.
We just talked about that, earlier today.
So that's even with good employee healthcare benefits. And the reason I've been so successful is I understand how the system works, and I know how to quickly and effectively search for in-network providers. So even employee healthcare benefits
have their
fall
pitfalls.
Short, you know? They have their pitfalls. So women are less likely to be uninsured than men, according to the Family Foundation.
So, Mickey, how can we help maybe the listeners think about the steps they're going to need to take to investigate if they have a need at this point? Like they don't have an employer insurance program, and I understand that there's pitfalls there and there's still a lot of expense there that may not be affordable, but at least they have access, right? So,
So the first thing is taxes. Look to see.
Are you talking about the child tax credit?
No. I'm talking about the American Rescue Act. But so if you are a female and you do not have children, or even if you do, but if you are a female of our age group, then what I would do is I would look into Medicaid, your state's Medicaid plan, and what your income is to see if you qualify, right? And so if your state has expanded and your income is low enough that you qualify, then I would say that you should go after trying to get into Medicaid. The trouble is, I know for people who are disabled, here I think in the state of Virginia, it's roughly 3 years to get on the list.
Wow.
And there are hoops that you have to jump through.
Wow.
Like if you do not have a car, but they will make you go to a provider 40 miles, an hour and a half away for an evaluation. I know somebody this is happening to, for an evaluation in order to see if you qualify. There are hoops, and it is very difficult. And if you make too much money, that's going to be a problem, right? I would suggest if you have low income,
start there,
right? Joy and I understand this because our mom was in this class, and we watched her work
like a dog,
crazy, like a dog, and it didn't matter, did it? So I would say, go if your income is above a certain level of the FPL, then go and look at the ACA, because what it comes down to, if you don't have your health, you can't work.
Well, that's true.
And
yes.
So, and I know people say it's too expensive. My friend, her direct pay is actually more expensive than the products that the ACA was offering to her.
Well, that's what I found to be the case.
Yes,
I did.
And the other thing is if you want a low deductible, and it's regardless of what kind of insurance you have. If you want a low deductible, you're going to pay a high premium.
Sure.
If you want a low premium, your deductible, you are likely never to reach it. Hopefully, you're not likely to reach it,
right?
Because you're in decent enough health. But it means that if you have high cholesterol or diabetes, you might not be able to get back to pay for all the tests and medication and stuff. So It's something to consider. The trouble with our healthcare insurance system is that we see it as a commodity instead of a right. Right?
That's true.
We don't see it as life, liberty, and the pursuit of happiness.
Well, because it isn't here. Unfortunately, it isn't for us. Yeah.
Right. So the system doesn't work, and it doesn't allow people to be healthy so that they can work. But I think the first thing I would say is if your income is too high for Medicaid, I would still go to the ACA and get a plan. You're likely to have to drive further and to find a provider. It's not profitable right now for the insurance companies to participate in the ACA.
Sure. But I would say, I think what women need to consider is, while you can access the ACA, and hey, it may not be ideal, but it is something. Right. And you may not get your preferred care, your primary care physician that you're used to having. And that sucks, quite honestly. But
it sucks, yeah. That's right.
But it's access. It's access to health care. And if you can get that for nothing or a reduced premium, just to have the access to it is so important. There's access to insurance or to health care. Don't deny it just because your doctor may not be in there. You may have to switch doctors, and that's unfortunate.
Yes.
But that might be the choice you have to make in order to have that health care.
Right. And if you're doing direct purchase, and including the ACA. So open enrollment is once a year, and you cannot change unless you have a life event. So like death, birth, whatever, then you can change
mid-year
aspects of your plan. But each year you should evaluate, and it may mean that you switch every year. I know some people who they do exactly that every year, and it's a pain for them, but they're self-employed.
Right.
And that's how they manage with their family, because they have a family. There are things that when you get into your plan, if the plan is not working for you, If you're having difficulties, depending on what it is, you can always do some advocating. There's an appeals process. Every insurance company is required by law to put what that process is and where to send the appeal and what kinds of documentation, you would need. It's on the back of every EOB that you have. It should be readily accessible. There are things that you can do to try to pick a good product with a company. You can do your research about what their quality of customer service is and how they respond to problems that you might be having. But certainly there's an appeals process.
That's a tricky process, yes.
And it doesn't matter which insurance you're on. That is a tricky process. It's time consuming. But there's one more area where you can get health care, but it's not insurance, which would be a community healthcare center.
Right.
And I'm going to use our father as an example. He's not a female, obviously 45 to 59, but he has Medicare. He has gap insurance, and his primary healthcare provider is a community health center. So, but he drives a great distance so that he can save on his copays. They charge what his copay on the because they'll take his insurance. And I imagine they take everybody's insurance. And then they do things on a sliding scale with the ability to pay.
Mm-hmm.
So that's another thing. So while you're waiting to get insurance, you can get healthcare with a community healthcare center. So I'm going to go into Joy's little area here and say, what's your pocketbook?
Right.
Right.
That's
and
kind of how we got started down this path in the first place. We actually did an episode not too long ago about personal finance. And again, not to spend too much time on the soapbox, but I can really get on the soapbox about that.
Okay. So healthcare insurance is the same as paying yourself. You pay, what do you say? You pay yourself first, right?
Oh, yes.
That's right.
Yeah.
Mm-hmm.
You need to include that. But yeah, that's what I would do. I would start with the ACA. If you have access to employee healthcare benefits, but you think you can't afford it, go talk to your benefits department. That is what they are there for. Go talk to them, tell them what your concerns are, and they will help you figure out. They can't tell you what plans to pick, but they can help you, and they can help you work that out. Go talk to your employer and get those benefits if you can. And if you can't, go to the ACA. If your income is too high, go to the ACA.
Yeah. I think those are great last minute recommendations. The HR department is there to help the employees. And so they're there. They have all the information available to help you make the right selection for you based on your situation. And it's private. So they have to keep that information private.
In order to help you, especially if they're going to help you advocate, if they're going to help you with your appeal or whatever, they have to get an authorization from you by law to be able to help you. So you should, before they start, you should be asked to sign an authorization, which is sort of like a HIPAA thing. So
many companies also have, as part of their benefits plan, an advocacy program that allows you to call and get help making those choices and making the best decision for you around your benefits. So those are important to utilize if they're there.
Yes. Yeah. Yeah. They are also, if you're having a mental health care crisis, by the way, and you have access to employee assistance plan.
Yes.
They are required by law to find and get you into a facility or into a therapist. I think they get about 24 hours and they have to move very quickly. So if you're in crisis, please call, first of all, the suicide helpline. And if you're having those kinds of difficulties, if you're in some kind of crisis, contact your company's EAP hotline and they will work very quickly to get you, because that's separate from your advocacy segment within HR. Contact the employee health, especially during COVID. This has been just very hard for everyone.
It has. And accesses are short, but
yes. Yeah.
We'll put links to a lot of this information with the podcast so that people can access the places they need to.
We'll put all that information in the description of the podcast episode. If you want to check out any of this information, all the links that we can provide, everything possible, we'll put that information in that episode description. And thank you so much for your time. We really, really appreciate you coming on and giving us the benefit of your experience. Oh, yes, not a problem. Maybe we'll have you again shortly.
That would be great.
All right.
All right. Thanks. Thanks for having me. All right. Bye.
Thanks, Mickey.
Bye-bye.
All right. Bye.
Bye. Okay, bye-bye.
Bye. Thanks for joining us. We'll be back again with another episode.
See you next time. Bye-bye.
Thanks for listening to this episode of Girlish Gurus. We hope you'll join us next time for a new, interesting, and fun topic. Be sure to check the description of this episode for any links or information about the episode's topics and to find us on our social media platforms.
And don't forget to download this episode, give it a good review, and share it with your girlfriends. The more interaction we get, the more episodes we can post.
Thanks, everyone.
Thanks. Bye-bye.
Bye.